and welcome. We're your hosts, Apurva
and Jolie. In today's episode of Minds in Menstruation, we'll be discussing menstrual health and sanitation issues among schoolgirls in Uganda.
The struggle of women in low-income countries to maintain their menstrual health while combating cultural stigmas is well known. Our case study discussed the use of low-cost sanitary pads among 13 to 20-year-old girls across several schools in Uganda.
Researchers investigated the use of two commercially produced sanitary pad products, AfroPads and Maca pads. Through measuring the use and responses to these products over a wide range of schools, it was found that the schoolgirls significantly preferred more costly menstrual products, but were unable to access them.
To further discuss this pressing issue, we have Dory, Tina, Alexander, and our guest, Dr. Amy Sapkota. Dr. Sapkota is the director of the CONSERVE lab at UMD, which focuses on sanitation and sustainable water reuse.
In 2010, she published her own study regarding the misuse of antibiotics for menstruation among women in Southwest Nigeria, and we hope to gain more insight from her expertise today. With Dr. Sapkota, we'll discuss cultural and structural barriers to improving menstrual health and different solutions to addressing them.
Welcome, Dr. Sapkota, and thank you so much for being here. We wanted to start off with a fairly broad question for you. How is sanitation and menstrual health in impoverished countries personally significant to you?
Okay. We all wear many different hats in life. So I think I'll give you two different perspectives from my point of view. So first of all, as a woman and a public health scientist, I'm a very strong proponent of women's rights and women's health overall at a global level. However, unfortunately, when we talk about the intersection of sanitation and menstrual health, particularly when we're talking about these issues through the lens of women in developing countries, this is really an area where both women's rights and women's health are lacking. And as you know, as you've probably researched and studied, this is due to structural factors, this is due to cultural factors, governance factors, a lot of different variables that play a role in this. So that sort of gives you a very broad answer from my perspective as a woman and a public health scientist, but at a more personal level, I'd like to talk specifically about an example regarding these intersections between sanitation and menstrual health, looking at Nepal. So I'm not sure if you're aware, but my husband is Nepali. He immigrated to the United States about 20 years ago. And so our whole half of our family are still there in Nepal. And unfortunately, in some areas, now these are not the areas of Nepal where our family is from, but in some areas of Nepal, particularly in parts of far western Nepal and midwestern Nepal, the practice of chowpatty is still implemented. Chowpatty is a centuries-old Hindu practice, and it's really based in this, cultural belief that women who are menstruating are polluted or impure or unclean, and you should not be touched, should not be interacted with, because of this cultural sort of, it's really more of a superstition. When women and girls, so it's not just women, it's young girls as well, when they have their periods, they're not permitted to enter their homes, they're not permitted to cook for their families, they're not permitted to touch or interact with their animals, for instance. And instead, particularly for sleeping, they're relegated to menstrual huts that are usually ramshackle shacks that are created and built away from the family home. And the problem is that what we've seen is every year we see particularly young girls die in these huts, and they're dying as a result of a number of different issues. One is due to smoke inhalation. So the huts are not built to have a fire in them, but because of very cold weather that you can see in Western Nepal, the women will try to build a fire and they can die of smoke inhalation. They can just die from being exposed to the cold and other severe weather elements. They can die from snake bites. So you can see that this is just a horrible practice that's really built on this cultural belief that women are just not clean and are just impure during this very natural part of a woman's a monthly cycle. So it's such a brings back a lot of emotion, an emotional response for me, because I have family members in Nepal, although they're not in these areas where this practice is still implemented. But it's just such a shame that this practice continues today, despite being illegal by the Nepali government, because you just have this enormous cultural superstition that a woman is impure, and that if you interact with or touch with her during her menstrual cycle, that this will bring you bad luck. So it's this type of completely baseless, not based in science, not based in fact, very harmful practice that really needs to be stopped. And there's so many other similar practices even in other developing countries, but stopping these types of practices is only going to happen through education, through outreach, but also through very strong community-driven approach. This is not something that can be stopped from sort of an outsider coming in. This has to be driven by community members, particularly male members, fathers who have lost their daughters really need to be stepping up and really trying to change this practice. So this is just one very specific personal example of how far we need to go in terms of addressing these linkages between sanitation and menstrual health issues in women, among women, particularly in developing countries.
Thank you for sharing that. I definitely agree, and we've talked about it in class as well. Now, to transition, in your 2010 study, you looked at misinformation around menstrual health and hygiene, specifically with the misuse of antibiotics to treat menstrual pain. Could you touch on some of the structural barriers you faced in addressing this? And along with that, what are some cultural barriers to implementing WASH interventions?
Basically, just in a nutshell, we found that among these university-educated women at 4 different universities in Nigeria, about 1 in 4, or 25%, were utilizing this self-medication practice, which is not good. But while we were working on the project, to get back to your original question of the specific structural barriers that are there to accessing feminine hygiene products, or barriers to implementing WASH interventions related to menstruation, there's a number of different types of barriers. So first, there are economic barriers. There are availability barriers to accessing feminine hygiene products. And over this past year, all of these issues have been compounded during the pandemic, where it's very difficult sometimes for women to get a hold of appropriate sanitary products. But I think potentially bigger barriers is what we were mentioning earlier, is this overall cultural taboo and stigmas that are tied to menstruation, and trying to navigate those barriers are potentially more difficult than figuring out a way to provide women with access to different products. I'm not sure if I answered your question.
No,
you go.
Sorry, no, I think you did. And also that definitely, what you talked about culturally also definitely gets into how your study was still on women at universities, attending universities. And I think a lot of times people will have education be the end all be all solution. But this was just a good example of how even these university educated women are still affected by their cultural stigmas and whatnot.
Mm-hmm. Yeah, and I think also because even though they may be highly educated in a number of different areas, you still have this culture of silence really around menstruation, where they still may not have had appropriate education with regard to their own menstrual hygiene management.
Thank you, Dr. Sapkota, for your response. Just to dive deeper, can you further discuss some methods that you find effective in improving women's hygiene?
Sure. So broadly, talking about improving women's hygiene as it relates to sanitation overall, there's a couple of really important, well-established factors that can make a difference. So uh, really, particularly in areas that don't have access to water, sanitation, and hygiene facilities, these facilities need to be provided. So getting into the specifics of that, particularly in schools. So girls need to be provided with access to separate toilets that have closing and hopefully locking doors where they can have privacy. They need to have disposal options for sanitary products, and or access to emerging products that don't require frequent changing or disposal. So there was I think it was a few years back, a program in Nepal where they were distributing silicone-based menstrual cups. I think it was called the Ruby Cup in Nepal. And it's a very safe alternative to pads or tampons. It doesn't require as frequent changing, and it doesn't require disposal because it's something that you clean and you reuse. But what it does require is adequate water and soap so that you can adequately clean it between usage. So these are other options. Hand washing stations, of course, are absolutely key. But overall, what needs to be provided in terms of infrastructure are areas where women and girls can effectively manage their menstrual hygiene in a very safe and a private way. So sort of all of these components are necessary. You really need a holistic response to improving infrastructure related to menstrual hygiene management. But, as we've discussed earlier, infrastructure and access to either, some sort of sanitary product or silicone-based cup is not going to solve the problem. You really still need to address these existing taboos, the existing stigmas that are just, over, centuries linked to menstruation that just, again, lead to this culture of silence and the misinformation that then arises. And I think that's the more difficult issue. It's always more difficult to change people's behaviors than it is to just provide a substance or provide a product. Changing cultural norms is such a heavy lift, as you all have been probably learning throughout this course.
Just as a follow-up question to what the example you just gave, were there any cultural pushbacks on using the menstrual cups? Because in our case study that we're discussing, when talking about insertion products, there is a lot of hesitancy, both with just using them and with how expensive they can be because of the low demand. I was just wondering what that sort of situation was in the example that you gave.
So I haven't read about it in a little while. I'd have to go back and look, but I'm pretty sure that it was actually a surprisingly effective campaign with the Ruby Cup. And I think, there's so many micro cultures, and this was in Nepal and they still are really based in the caste system. So I think depending on what micro culture you're working in, I'd have to go back and see where the initial study was done for the Ruby Cup. You would face different, barriers that needed to be broken down. But in the case of at least the study that I recall, it was a successful launch of this particular product.
So, just going back to an earlier topic, I'm really interested in this discussion you've led about community engagement for local change and especially overcoming cultural barriers as they relate to women's health and menstrual health. And you've talked specifically about the importance of integrating men into these conversations. So, I'm curious to see your thoughts on how that can be done effectively. And do you consider education programs and community-based discussions some viable options to consider for starting this?
Yeah, I think it's probably all of the above. I think focus groups in a safe space among small groups of people coming from the same village, the same community, with local health practitioners can be an effective way to start to understand sort of what are those barriers, but then what are also the facilitators. In just some of the articles I've read, just going back to this example of Child Buddy, in many cases, it's fathers who have either lost their daughters or who have very young daughters and who think that this is just, absolute insanity that needs to be stopped. And so that's sort of what was brought to mind when I gave the example of I think it's effective for men to be involved. It's really these fathers that could be effectively involved. But again, it's also, I don't know, maybe using examples from other parts of the same country also to talk about how, sort of like the with Child Buddy, the overarching fear in superstition is that it's just bad luck to be in the presence of a woman who's menstruating. And so if you have personal stories where people can say, hey, look, my wife, my daughter, they sleep in my house when they're menstruating. Nothing has happened to our house. Personal accounts of families still being safe and thriving despite changing practices and going against these norms, I think can be effective. But it is certainly an uphill battle because, it's very telling that it's, this is illegal in Nepal now. You actually face very high fines if this practice is implemented, and yet those overriding cultural norms in some of these areas and superstitions are still overriding even a law or a fining process. So it is certainly an uphill battle.
I was rather curious what these CDSPs could do to help, like stop the vicious cycle or just like help menstrual health among women, and how like these companies that are name brand and like less affordable for all individuals or some individuals, like how they can be more of a help.
Mm-hmm. And I'm not familiar with the acronym.
The CDSPs stand for commercially produced disposable sanitary pads.
Oh,
yeah.
okay.
I mentioned two company brands. I can't recall the names off the top of my head, but regardless, just how these like bigger companies can help.
Mm-hmm. Yeah, and I think the question is, what is sustainable in the long run? So, a lot of companies are very philanthropic and they want to be involved, and they have mechanisms to donate products for a certain time period over a certain study, or a study period. But I think the question is, how sustainable is it? Is it something that the company can continue to provide over time, or is there some sort of microfinance mechanism in place that is going to address the sustainability of these purchases over time? So this is why I had touched on earlier that while help from nonprofits, help from companies is always or can be very beneficial, real change doesn't happen unless it's a community-driven process where you have complete stakeholder and community engaged solutions and interventions. Otherwise, all of these, best laid plans that are coming from a really good place, whether it's, a company's philanthropic approach or an NGO's approach, it's just not going to be sustained unless there's a local mechanism to continue to finance whatever the intervention is, with, again, the local knowledge that it's going to take to have a sustainable change in behavior, based on the educational aspects that come along with that intervention. Just out of curiosity, are the I don't know if you've seen the reusable underwear that just have, is that part of your case study as well, those products?
No, the reusable options that our case study talks about are called AfriPads, if you've heard of them. Which they, as well, like many reusable products, the main barrier to using those is a little bit of a higher upfront cost, and also people feeling uncomfortable with washing and reusing them. I don't think like the menstrual absorbent underwear has really been, from what I've seen at least, they can get pretty expensive. So I don't, that's probably the main barrier to having those be used in this case study, at least for the.
Yeah, I don't really know much about them, but I was just curious if they were taking off in some areas of the world that I wasn't aware of.
I think that would be a really interesting example, actually, if those companies were able to like make a donation or something, or have that sort of product be researched in this case. That would be really interesting to see.
Mm-hmm.
Yes, and going off that, I'd like to reiterate that one of the main components of our case study really depends on this overarching theme of cost effectiveness, so that more women and girls in these under-resourced regions can access these products easily without expense being the underlying issue. However, what we found from the results of this study was that a lot of the girls preferred the more costly name brand products. They just did not have the means to get to them. As a result, the compensation with cheaper or homemade products may not be as effective or healthy for use, which then contributes to some examples we've seen with the stigmatization and school absenteeism as consequences that we've already discussed. And I'd like to see an additional study done to see how these harder to access commercial products could be incorporated into these communities sustainably.
Yeah,
as
absolutely.
well.
And as a personal aside, when we go to Nepal every year, except during this past COVID year that's been so tough for everybody. And of course, we're always bringing gifts for everybody. And the number one request from my sister-in-laws are pads. And I'm always asking them, how much how much would you like? And they're like, as many as you can bring, because they're just, it's such a superior quality. They're lightweight. They are so well engineered. And I always do bring a ton, but it's just, it's not sustainable. I wish I could do more,
Yeah, it's pretty interesting you mentioned that, because in our case study, like one of the topics that they cover is, or just like comments that they say, is that in Uganda, like a packet of 10 pads costs an average of $1.35 in like US currency, which is more than the daily income of many of the working parents. So it's just really interesting how women have to make that sacrifice for, to support their families. And it's kind of sad that they have to make that mental choice.
Mm-hmm. So is that an area where the silicone cups have begun to be used, and or are there any access to any type of silicone cups, and are they cost prohibitive?
That could be something to look into. It's not mentioned in our case study. However, it should be noted this case study was published in 2012, and the menstrual cups have gained a lot more popularity since then. So that would definitely be something we should look into.
Mm-hmm.
Thank you again, Dr. Sapkota. This discussion was purposeful and necessary, yet the effort certainly does not stop here.
The most crucial takeaways from our case study indicated that the Ugandan schoolgirls were uninformed on how to effectively manage pain, suppress leaks, and afford the menstrual products they needed to best maintain their menstrual health.
Ultimately, low-cost sanitary pads as an effective intervention succeed in providing girls and women with more accessible variety they can choose from in managing their health. However, improvements can be made addressing deeper-rooted cultural constructs and lack of awareness and education.
It is essential for us to find ways to promote these conversations about menstrual health throughout all communities, normalize these topics for anyone to discuss, and suppress inaccurate stigma involving menstruating women through positive and truthful accounts from community members.
And for our audience, thank you for listening to our podcast on menstrual health.